Medication isn't cheap. We all know that. And sometimes that price tag pushes people to delay the medication or stop taking them altogether.
Yeah, 90s medical expert Dr. Payal Kohli joins us this morning. Dr. Kohli, good morning.
Good morning.
So the findings from the survey from the CDC, they weren't really that surprising, but, you know, not entirely unexpected. Can you summarize exactly what it showed?
Yeah, I see this in my clinic every single day. Twice a day medicine, taking once a day, taking something every other day, cutting the pills in half. People do this all the time. And really what we found with the survey is that 1 out of 10 adults under the age of 64 have admitted in the last year to doing something funny with their medicines as a way to cut costs. And if you look over the age of 65, that number goes up to 1 out of 5 adults.
That's a lot.
And then if you dive a little deeper, you see that women do it more than men. We see that adults with disabilities do it more as well, again, for some of those cost-cutting measures. And then we also see, ironically, that people whose health is worse at baseline are more likely to do this, perhaps because of socioeconomic reasons, than those who are in better health.
Why do you think women were more likely to do this?
I think there's a number of reasons for that. The first is, we're so used to being the caregiver rather than the care receiver.
I had a feeling I knew where you were going with that.
So all the time it's about our kids, about our husbands, about our friends, about our,
dogs.
About our dogs, exactly, and not about ourselves.
Yeah.
The second, I think women on average make a lot less money than men. And I think that if it comes to income and the affordability of medications, we see that. And then when you're under the age of 65 as a woman, you're actually more likely to be on more medicines than men. So if you're expected to take a whole bunch of things and you can't afford all of them, you have to start rationing.
So, I mean, yes, that's a really good point right there. Of course, though, we do need people to take their medicine. But when it is unaffordable, what do you tell your patients? Like, are there ways around this?
There are. I would say the first and most important thing is to have a really frank discussion with your doctor. I really appreciate when people tell me honestly, doctor, I'm not going to be able to afford this, because a lot of times we don't know that.
Yeah.
And people are embarrassed, or they're worried, or they think they're going to be judged, and so they don't say anything. So I think talking to your doctor about generic alternatives, that's the easiest thing to do. Now, sometimes I say, no, this is really the safest medicine for you. I give a lot of blood thinners to people, and warfarin is what we used to use, and that's cheap and generic, but the newer medicines like Eliquis, Pradaxa, Xarelto, those are much safer. Yeah. So I push back and I say, I really think you need this brand name medicine. But here's what we're going to do. We're going to talk to the company and see if we can get you either copay cards, we can get you foundation support. So a lot of these drug companies have foundations that support people who can't afford their medications. And then there's income limits as well, where people who are below certain income limits, you can actually provide them assistance as well. Don't go to Canada and Mexico. Don't go to compounding pharmacies. Don't get stuff off the internet, because that makes me really nervous.
Talk about, you're kind of touching on it right now, but clearly, you're skipping medication, you're rationing it, you're not filling the prescriptions, you're doing things that are funny with it, clearly can be very dangerous. But talk a little bit more about the medical implications of doing that.
It's mind-boggling, because the Medicare donut hole, which is a period later in the year when Medicare doesn't cover your prescription medications, is a time where we see a dramatic increase in strokes occurring, because people are cutting down on their blood thinners or skipping their blood thinners altogether. So, the first thing that could happen is something called a rebound phenomena. So, for example, a beta blocker, which is a medicine designed to slow down your heart rate, if you suddenly stop taking it, you could get a rebound. You could get tachycardia, fast heart rates, you could have an arrhythmia that could get precipitated. So some of these medicines, if you stop them suddenly, can actually cause rebound or worsening of disease. Other medicines, like blood pressure medicines, are sort of designed to maintain your chronic disease management. And if you stop them or not take them as you're supposed to, you can cause damage to your organs, over time. And then for certain other things, we think we're sort of saving costs by skipping medicines. But in the end, you take a small problem and turn it into a big one, like a stroke.
Exactly.
And you've actually increased your healthcare expenses.
And it sounds like this is far too common. So, Dr. Kohli, we appreciate you being in to help break this down and help some people out.
Yeah.